Hi everybody, it's Menopause Barbie. Although today I look more like Dr. Taylor than Menopause Barbie, don't I? Well, sort of. Wanted to wear the hat to offset the coat. Anyway, thanks for coming. You're joining me for tutorial number 12. And if you're following along in the book today, it's pages 78 through 80. And if you're following along in the outline notes, we're on pages 9 and 10. You know, in the last tutorial, I gave you the big, long list of signs and symptoms of menopause. And before that, you learned that when you stop producing estrogen at menopause, your FSH rises. And before that, you learned that the average age of menopause is 51. So today, we're going to put all that together and talk about how to go about actually diagnosing menopause. So that's why I'm wearing the lab coat, because today I'm going to be a diagnostician, you know, and I thought a lab coat made sense. First thing we're going to do is take another look at that long list of all the things that could indicate the onset of menopause. Okay, here it is. Less frequent periods, hot flashes, night sweats, insomnia, fatigue, forgetfulness, mood swings, irritability, depression, cravings, breast pain, and joint stiffness. Okay, let's add a little dry skin, hair loss on the scalp, hair growth where you don't want it, vaginal dryness, urinary tract infections, urinary incontinence, weight gain, increased or decreased sex drive, acne, and finally, headaches. Phew! You know, you might think that with all those signs and symptoms, who needs a lab test for diagnosing menopause? You might think, God, wouldn't any 50-ish-year-old woman suspect that she's going through menopause with all that happening? Heck, with all that happening, wouldn't even family and friends be able to diagnose menopause for you? You know what? If you were thinking any of those things, you are absolutely correct. We don't need a lab test to diagnose menopause any more than we need one to diagnose puberty. So I'm going to take off the lab coat because you don't really have to take a test. But there is more to it than that. So, remember we said menopause is puberty in reverse. And we said it's not a disease any more than your periods, puberty, or pregnancy are. For the most part, menopause is blatantly obvious. You know, Mother Nature did this extremely good job, too good a job, of making menopause so obvious that it's really, really, really difficult to miss it. But despite all those clear signs and symptoms, menopause differs greatly from woman to woman. And some women have very few of those symptoms. You know, some women have none of those symptoms. Okay, I know you don't want to think about them or tell them what you think of them, but some women don't even realize they're going through menopause. And don't forget, many of the symptoms of menopause aren't unique to just menopause. They mimic other diseases. They mimic thyroid problems, depression, dementia, malnutrition. So, because of that, and despite the obvious nature of menopause, we actually do have a lab test to confirm it. But you know, going back to the fact that we don't need a blood test, if you're 50-ish and you feel like I'm talking about you and describing you to a T with that list of signs and symptoms, you can probably omit the test and work on managing your menopause your way without any laboratory confirmation. It's kind of like that saying, if it sounds like a duck and walks like a duck, well, if it sounds like menopause and it feels like menopause and other people suggest that you're probably going through menopause, then it probably is menopause. But you know, I think peace of mind is everything. And I also believe that the greatest fear is the fear of the unknown. So I think you should do whatever you need to do to be sure, regardless of your age and regardless of your symptoms. You see, I have a huge problem with physicians who belittle your concerns. When you're concerned about something, you need to have peace of mind. You are entitled to get whatever information you need to feel certain and secure. And I have another big hang-up about physicians who minimize your circumstance by saying something like, oh, it's only menopause. You know, only menopause, that's like an oxymoron. Those two words don't go together. Only menopause. I mean, my God, look at the list of symptoms I just gave you. It's not minor. There's nothing mild about it. It's a huge event in your life. It marks a tremendous transition in your life. And face it, it's at a difficult time anyway. You know, it's like you're in a sandwich at the time. You know, you've got elderly parents with their own issues, you've got young adult children with their issues, and you're in the middle dealing with the pressure from both sides. It's a difficult time. You know, in my practice, there are a couple of words that I consider to be forbidden. One of them is the word routine. You know, what's routine to those of us in the medical profession isn't routine to you. And you shouldn't let people in the medical profession treat your major concerns like they're routine. There's nothing routine about menopause when you're going through it. It's huge. It turns your life upside down. So don't let someone tell you it's only menopause. Another forbidden word is the word minor. You know, nothing's minor. You know, we in the medical profession compare the most minor things we've seen to the most significant things we've seen. Well, that's us. That's not you. Everything you deal with is major. A yeast infection is major. A pap smear is major. All these things need to be handled as major if they're major to you. So I think you need to make sure you don't settle for people who belittle your situation. Okay, so there's no such thing as only menopause. It's a huge matter. I mean, look at all these tutorials I'm giving for you. It's a big deal, and it's something that you need to be very prepared for and learn so much about. So that's my little diatribe. Pardon me for that, but I just had to tell you that I think it's important for you not to settle for less than you deserve. So if you feel the need to rule out other possible diagnoses before labeling your symptoms as menopause, you go right ahead and do so. Even if you're just in a major state of denial and you don't want to admit that it's menopause, get proof before you settle for anything. Now, in order to diagnose menopause with a lab test, remember our discussion about the feedback loop. I'm going to pull my prop over. This is the feedback loop. Remember, it consists of the brain that produces the hormone FSH, and the FSH travels to your ovaries and says to the ovaries, produce estrogen. If your ovaries respond and produce estrogen, fine. But if the ovaries don't produce estrogen, your FSH gets angry. And your FSH rises because your brain keeps sending out more and more FSH to talk to the ovaries. So here you have FSH that rises and gets higher and higher and higher. There's more and more and more and more FSH coming out, trying to get the ovaries to respond. Okay? So that forms the basis for our blood test for menopause. So what do we use to test for menopause? We do a blood test of FSH. We test your FSH blood level. Now, if you're premenopausal, long before the transition, your blood FSH level will be between 2 and 15 milli-international units per milliliter. If you're beyond the transition and you're postmenopausal, your blood FSH will be above 30 milli-international units per milliliter. But if you're perimenopausal and you're going through the transition, here's what your blood FSH looks like. A roller coaster. It is up and down and all over the place. And that's because You're transitioning. So what that means is that if you're going to use this blood test, you have to do the blood FSH level more than once for it to have any meaning, especially if you're having occasional periods. Remember, the periods start disappearing, but sometimes you have an occasional one, and if that's the case, you really have to get a few blood FSH levels to make any sense of it at all. You can also use the blood FSH level to rule out other medical problems that have some of the same signs and symptoms as menopause, like the ones we named earlier, malnutrition and thyroid problems. Very commonly, thyroid problems have to be ruled out. And so blood FSH level can help you do this. You can also use it to confirm postmenopause. If you say, well, I want to make sure I'm postmenopausal, you can do the blood level again, and it should be well over 30. Now, you don't need to use the blood FSH level to override your own intuition. You see, here's another area in which I kind of differ from most physicians. I believe that if your intuition and the lab results are at odds with one another, I believe you more than I believe the lab value. Okay? And that's because you know yourself better than anyone else does, and definitely better than a lab does. So honor your intuition and your opinion, and don't let anyone shove those aside and say, oh, you don't know what you're talking about. You do know what you're talking about. Okay? So if you decide you want to get this blood FSH level to confirm postmenopause, check for perimenopause or anything, remember something. Estrogen from any source is going to affect the FSH level. What that means is you have to discontinue all estrogen before you get the blood test. You need 3 weeks of no estrogen before you get your blood drawn. So if you're taking birth control pills, you got to stop them. If you're using any kind of hormone therapy, you got to stop it. Okay? Now, there's a second way you can evaluate your hormone levels if you want to measure your tendency to be menopausal, and that is you measure the quantities of hormones in your saliva. You're not going to be measuring FSH though. You're going to be measuring estrogen, progesterone, or testosterone, or all three. And the levels of those hormones in your saliva parallel those in your body. But they're going to fluctuate more rapidly than the blood FSH levels do. Salivary hormone testing is more flexible than the blood FSH, but it's not as accurate. So just be aware of these differences so that you can do the one that works better for you. If you want something that's more flexible and easier, do the saliva. If you want something that's more accurate, then get the FSH. But here's another thing you should know. MDs like myself, medical doctors, traditional medical doctors, we don't do the salivary testing as often as we do the FSH testing. Some MDs won't do salivary testing at all. So if you want salivary testing, go to your osteopath or naturopath. They do it all the time. I don't even know if they do the FSH much at all. I know DOs do. Naturopaths may not. So if you want blood, go to your medical doctor. If you want saliva, go to your DO or your naturopath. And whichever method you use, no matter what you do, timing is important. And you'll need to test more than one time to compare values. With all of these tests, your best time is early morning. First thing, wake up, go straight to the lab to get tested. And no matter what you do, if you're having any kind of cycles, you're going to have to repeat more than once. Now, the way you time cycles, the way you know where you are in a cycle, is you always consider day 1 of your cycle, the first day you have bleeding, any kind of bleeding, whether it's bright red or just a spot or it's dark brown or it's a lot or a little. Day 1 is the first day you bleed. And then you count the days. And the days you want to do testing, the best days are days 20 to 23. That's when you're going to get your best time to do the test. Okay? So you've made it. There was no quiz today. There was no worksheet today. I decided to make things nice and short and sweet to reward you for all your dedication. But, by the way, after watching these tutorials, you're going to find out that when you go to your physician or your naturopath or your osteopath or your herbalist or nutritionist or whoever you go to for help managing your menopause, they are going to love working with you. And that's because all professionals love working with an educated woman who isn't operating from information off the internet or what her girlfriends told her or all the other misinformation that's floating around everywhere. You know, what you're doing by watching these tutorials is going to serve you so well that it pretty much really kind of surprises you. You're going to find that every single day you use some piece of information that you learned in these tutorials. It's really great that you're doing this and that you're learning all this. You're never gonna regret it. So thank you for coming. I congratulate you again. I'll talk to you the next time. Now the next time, it's gonna be something that I call the balancing act. And I know you're wondering what that's gonna be all about, and you're gonna have to come back and find out. So I'll see you then. Goodbye for now, and we'll talk to you later.